This is Dr. Usama. Today we're going to talk about breast cancer in general, for general public, especially how to identify it, how to prevent it, and how to get it treated whenever you get it diagnosed. Unfortunately, so basically, we are going to talk about what the breast structure is, what is breast cancer, what are the causes of breast cancer, stages of breast cancer, facts and stats, risk factors, breast cancer symptoms, how to prevent breast cancer, screening and early detection, and so much. So let's start with the structure of breast. So basically, what a breast is a secondary sex organ in the female, and men have rudimentary structure of breast, but they do not develop it properly. Females have breasts, usually two breasts for lactation purposes. So this part here is the muscle. Let me annotate. So this area here is the muscle that usually the gym bros train. These are pec muscles basically. So the breast structure sits on this area. So this is the structure of breast with the collecting duct. There is some of the fat in the parenchyma, and these ducts lead to the glands or lobules. So whenever the female is pregnant or lactating, these glands lobes produce milk, and which is secreted and pushed through this nipple. So this is a rough structure of breast. So breast is a complex network of lobules, lobes, and ducts. Main function of breast is breastfeeding, of course. Many breast changes occur in woman's life throughout the hormonal changes, and most of changes are benign. So usually, whenever a female steps into the puberty, developmental changes set in. So the breasts are usually very dense in the start, in the reproductive years, and then after the menopause, breasts usually tend to be fibrous. So these structures get fibrosed, and regenerative changes set in usually. So moving to the next. So what is a breast cancer? Breast cancer is basically a tumor that just grows out of control. So usually there is a cell division, cell turnover going on and off throughout the female life. So whenever there is some sort of abnormality happens in the breast turnover of cells, because cells continuously die, and new cells are made to keep things going. So this is how cell turnover works. So whenever there is abnormal abnormally breast tissue start growing, so it gets out of control. So basically, tumors are like our organs or stars. I would say they're derived from us. They are more like our body, or derived from a part of our body, and they just get out of the control, and mutations set in, and then the secondary metastasis or the other secondary side start setting in once the tumor start disseminating through our blood, and or just travel through the tissue. So there are different ways how cancer spreads. So it depends on the type of tumor and the stage of the tumor. So breast cancers are usually spread to the other organs if left untreated, and may lead to metastasis in the brain, in the liver, in the lungs, in bones, and so on. So what are the causes of breast cancer? If we speak about the structure of breast cancer, or basically the microstructure of the breast cancer, so usually there are a lot of causes. Some can be genetic, some can be acquired, like food, lifestyle, smoking, and a lot of factors that contribute to the breast cancer. So genetic mutations are a kind of a red flag for the females. Some of the females got inherited genes related to the breast cancer, which is BRCA1 and BRCA2, that can be diagnosed by genotyping or gene sequencing. So this is how the genetic structure of a female can be screened, and if there are these mutations are present, these are very very big red flag. So there usually people who get diagnosed with these genetics or these gene malformations, they tend to have their breast surgeries done in their reproductive age to avoid getting cancers or developing cancers from the breast, because they have a very have, I would say, they are at very high risk of the breast cancers due to the genetic factors. So it's not like that mostly these mutations are the main cause, but these mutations can be acquired or spontaneous gene mutations, which mean the person is not genetically carrying the genes for the cancer, but there is some sort of genetic spontaneous genetic mutation during their life, and they just start growing cancer. So only 10% of the breast cancers are due to inherited gene mutations, which means a big chunk of the percentage of incidence of the breast cancer is non-genetic. So non-genetic causes include hormonal changes, different type of contraceptives. Some of them are kind of they pose a serious risk for the breast cancer. Moreover, smoking is a big cause, and non-lactating breasts, and the females who I would say they are nulliparous, they never delivered the child or never started lactation. So I understand this can be culturally some sort of insensitive if we talk about these topics, especially if we go about the non-genetic causes of breast cancer. So, if we speak about the non-lactating females, those who never got pregnant or never delivered a child and never got opportunity to lactate, so basically that's what those breasts are for, lactation. It's a rule of nature. So if you're not using uh, if you're not utilizing that organ, the hormonal fluctuations that are supposed to happen are not happening. So this is how we somehow we contribute to this. So I again once say that this is a very culturally sensitive thing to talk about, but that's also a factor, so we can't just ignore it. So there are different stages of breast cancer depending on the size of the tumor or the spread of the tumor or the type of the tumor. So usually there are three stages. Then there is an ultimate stage, which is stage 4. So usually in the stage, speaking about stage 0 or no breast cancer, this is the I would say a schematic structure of the breast. These are the lymph nodes that drain lymphatics from the breast tissue. There can be other vessels. Sorry. Then there is stage 1. Stage 1 means there is a very small size of the cancer which is not spread to the axilla or the peripheral lymph nodes. Then there is a stage 2 in which tumor is a bit bigger in size, and a small chunk of tumor is also traveled to the lymph node just below the clavicle bone. Then there is stage 3 in which your cancer is a sorry uh, the cancer is size of the tumor is a bit more bigger as compared to the stage 2 and 1, and there is a more number of, I would say, secondary species of the tumor. This is the primary tumor, and this is how it traveled here through these ducts here, and this in the axilla. So these are the secondary spaces where the secondary tumor is present. I would say this is a tumor, so a very small chunk of the tumor travel to through the duct to reach here and then start growing on its own as a separate tissue. So so these are total usually these are 5 in number, which means that now we have 5 tumors in that person. But this is a still local spread. Local spread means it is not spread to the other organs or vital organs, especially not to the lungs, not to the liver, not to the bones, not to the brain. So this is just a local spread, and the tumor is still nearby. It can be still managed conservatively, not conservatively, although it can be managed with minimally, I would say, excision or minimal breast tissue excision. Then there is stage 4, in which all the breast tissues, all the breast is densely involved. Multiple tumors can be present. There is multiple local spread of tumors. Then there is a metastasis to the lungs. Then there is to the brain and to the liver. So this is stage 4. In this case, we usually offer palliative care to the patient because some of the tumors are not resectable. Like if they are, as of my experience, I have seen patients in my surgery rotation with the multiple, metastasis. I have seen a patient with metastasis of rectal cancer, basically. So metastasis is not just like a big tumor resting somewhere else, and the primary tumor is on the primary side. It's like seeding or small pulse scattered throughout. So this is how metastasis can be dangerous, because can't just resect all of the vital organs or the liver or the lungs. So in this picture, these lesions seem to be very discreet, but in fact, their metastasis can be like beaded all over. Just spread small pearl-like structures can be spread throughout the lungs, the liver, and the brain, and they just start secreting weird substances that will lead to, congestion of the lungs, liver failure, and strokes, and so many things start setting in when once person gets metastasis. So we can only offer palliative care. I would say symptomatic care to those patients. So it is very important to self-examine and to get screening after 40 years of age, and in the females who are already at high risk due to their family history as well. So these are some of the facts and stats uh, of 2022 of the surveys. So the disease burden that got diagnosed in 2022 was 2.3 million were diagnosed with the breast cancer. 6,70,000 is a breast cancer death rate worldwide in 2024, and this is still increasing. And in third world countries, this uh, number of undiagnosed cases are still a lot higher than this one, and especially due to the social stigmas, they don't get proper treatments, so the death rate is also higher in those countries. So most of time, 99% of the breast cancers occur in women, but that 1% also occurs in the men if they have residual breast tissue, also called gynecomastia. But usually they do not tend to have that breast cancer, but only 1%. It's a very rare that someone male can develop breast cancer due to the. So mostly it happens due to the genetic predisposition if they have a very strong family history of the breast cancers. So worldwide, one woman is diagnosed with breast cancer every 15 seconds. One woman dies of breast cancer every 50 seconds. So this is a very high incidence. I would say this is a very, it's a very global issue that uh, breast cancer is number of is on the top of the reproductive organ cancers in the females. So there is another cancer, ovarian cancer, which is also a very common cancer in females. So these were the breast facts and stats. So usually these were the stats I wrote for another organization, and the surveys were held related to the UA, and in most type of screen cancers in UAE and United Arab Emirates, breast cancer is the most common cancer in the women. All the other cancers were below the list. So these are some risk factors for the breast cancer. So as I said, never having children or having your first child after 35 years of age is also a risk factor for the breast cancer. So let me speak about, there are, as I said, there are modifiable risk factors, and then there is non-modifiable. Non-modifiable risk factors include the risk factors that are genetically predisposition, as I said, BRCA1, BRCA1 and BRCA2 genetic mutation. So you cannot just avoid your genetics, but there is a lot of causes of the breast cancer that can be modifiable. So never having children or having your first child after 35 years age is a risk factor. Then currently or having using combined estrogen and progesterone hormone replacement therapy, which usually females get due to hysterectomies or in the early life, or due to the osteoporosis, or due to the severe bone degenerative changes after menopause. Women tend to have hormone replacement therapy that is based on estrogen and progesterone. So it is also a risk factor for the females who have previously uh, got a cancer in their one breast, or if they have hormone positive cancers in their family. So these two hormones are basically the flags of the breast cancers type, uh, because usually most of the cancers are hormone positive. Hormone positive cancers mean these two cancer hormones circulate in our body usually. So if a person is going to develop a cancer, so these estrogen and progesterone hormones help them to grow. So basically, these they tend to I would say they just circulate in the blood and go to the reproductive organs, and then they also start distribution going to the breast tumors that are hormone positive and help them grow, because they tend to attach to the tumor cells, and then let them, or I would say uh, allow them to grow unchecked, because these cells have receptors for these hormones. Current or recent use of birth control pills. So birth control pills can also be one of the causes of the breast cancer predisposition. No breastfeeding is also a red flag for the breast cancer, because it can be also a big risk factor for the breast cancer, because there is no active cell turnover in the breast as it should be in a lactating female. So it doesn't mean if a female have breastfed and she cannot develop cancer, but the risk of developing cancer in non-lactating female is way much higher than those who breastfed their children. So a diet rich in fat or red meat and poor in fiber and fruits, there can be also a risk factor for the breast cancer. Physical inactivity, overweight, or obesity can be also a risk factor. Smoking and drinking alcohol, especially smoking, is the biggest risk factor in any type of the cancer. So let's move with the next slide. So talking about the breast cancer symptoms, so these are the oranges that are demonstrated to uh, to show different type of sign and symptoms that can manifest presence of breast cancer. So number one is hardening of the breast tissue. Usually there are cyclical changes every month in some females that are totally normal. That breast tend to be some sort of tender and a bit bulky due to just before the menstruation. That is totally normal, and that is cyclical process. So that is not a problem. But if you see specific hardening, or one area of the breast tissue starts get hardened, and you are above 35 or 40, then you should go see your doctor as soon as possible. Then there is puckering. Puckering means that if your breast tissue or one side of breast just wall just starts to get invaginate in the breast. So the reason of this invagination or puckering is basically the tumor starts attaching to the skin of the breast, and then starts pulling it due to the fibrous structure of the tumor. So it's just tend to go in. Then next is skin erosion. So one manifestation of breast cancer is different type of skin, eczema like skin changes on the breast, redness or heat on one area, strange fluid or strange secretions coming off from the nipple, dimpling of the breast, then bump or lump in the breast that is usually that is unusual. And if you have self-examined your breast throughout uh, annually or biannually, and then you notice a small lump or a small growth going, whether it can be seen with the naked eye, or whether you can palpate it, or whether it is visible throughout. So that bump can be also a big sign for the breast cancer. Growing veins on the surface of the breast cancer. Breast engorgement is totally normal in pregnancy and in lactating mothers, but it is unlikely that females who are non-lactating, they tend to have growing veins. So if they have prominent veins on each side, or on one side of the breast, or prominent vein on any side of the breast, so this can also be a sign of the cancer. Nipple retraction is also a very common presentation of the breast cancer, in which nipples tend to invaginate inside the breast, which means the tumor is pulling, so have some sort of pulling effect on the nipple. So nipple invagination or retraction is some sort no it's a very very common classic presentation of the breast cancer. Breast cancer can also be in the form of breast asymmetry. If the tumor size ratio to the breast size is large, then you can also see new asymmetry on the breast. Then orange pale skin, there is also another presentation. We call it Paget's disease, in which breast vessels or lymphatics gets engorged, and the skin tends to uh, turn yellow or orange. And a very subtle form of the breast cancer is also a lump that is not usually visible on the breast, but if you tend to palpate deeply, then you can only see it. I see some of you are saying that presentation is not available. Can you guys see my screen?
Yes, we can see your screen.
All right.
It's just that the words for the symptoms are hard to read.
Yeah, that's lighter font, I just realized. So, talking about the breast cancer symptoms, so most people will not experience any sort of symptoms when the cancer is still early, or uh, I would say usually most of the time females, those who do not self-examine their breast, or if they are beyond 35 or 40, and if they are at the risk of breast cancer, usually development or growth of the breast cancer is not usually felt as abnormal, because you just don't feel it growing. You don't just know whether something is growing inside you, especially cancers. So unless if there is abscess or some sort of invagination into the skin, usually breast cancers cannot be you know uh, uh, caught early due to the presence of no symptoms at all. So breast cancer might have combination of symptoms. Some present very late, and some present earlier due to whether involvement of the skin or the chest wall or the chest muscles. A breast lump or thickening, often without pain. If you if a female self-examines the breast, and if they found to have a very I would say suspicious looking lump, if they feel suspicious looking lump with irregular borders, irregular margins, it is very hard like a stone, and usually they do not tend to have any sort of tenderness or pain. Change in shape, size, or appearance of the breast, dimpling, redness, spitting, or other changes in the skin. So these are the basic sign and symptoms I already explained in the previous picture. Change in nipple appearance on the skin around the nipple or areola, which is pigmented area around the nipple. Abnormal or bloody fluid from the nipple. So this is also a red flag sign in the females who are beyond reproductive age, or about premenopause or postmenopausal age. People with abnormal breast lumps should seek medical care, whether they are at the risk of cancer or whether they are not. But if a female is 35-year or 45-year plus, they should get annual screening of the breast, especially mammography, and they uh, I would say they must do their breast self examination. So in reproductive age, usually lumps cannot be cancer. It is highly unlikely that a female of reproductive age gets cancer like in 30s or 20s. But if they feel a lump, they should see their doctor, and the doctor will evaluate for them, or check or do ultrasound, or to differentiate from the tumor and help them how to differentiate between the tumors and the non-tumor like growths in the breast. So in young females, those who are not at reproductive age, or I would say, sorry, they who are not active or reproductively active, so they tend to grow some sort of fibrocystic changes in which there are small benign growths can be present in those female breasts, but they are usually tender and painful. But most of the times, cancer lumps are not painful. They are just suspicious looking in shape, size, and they make the breast symmetry suspicious looking overall. So, how to prevent breast cancer? Basically, as we are talking about modifiable risk factors. So, the very first preventative step is to breastfeed. So breastfeeding is a very essential to, for the hormonal fluctuation that happens due to the pregnancy. And then if the females tend to breastfeed their newborns, those hormonal changes are kind of a healthy turnover. They do a very healthy turnover, cell turnover in the breast. So breastfeeding is very important. Healthy diet is very important. Diet low in lipids and red meat or something. Smoking is also smoking should be, totally banned. I would say I'm in total favor of that. They they just quit smoking in any sort of cancer. Smoking is very preventable. Avoid hormones as much as possible. So usually people have, in some countries, that this is a culture like they tend to have use these hormones or oral pills regularly. But if they are hormone based, those can also be a big risk factor for the breast cancer. So avoid hormones as much as possible. Keep your body natural as it is. So in case of if it is too necessary to use hormones, like in hormone replacement therapy in females of the menopausal age, like 50s, 60s, so that should be under supervision, first of all. Second is they should get their breast screening done annually or biannually at least. Regular exercise is also very important. So how you can self-examine? So basically, it's a body do I would say know your body initiative, in which you just self-examine starting from the 20 years of age and so on. You just on do this on monthly basis. So this can be done in circular manner. So you just palpate in circular manner, like in circles around and just go in inside and inside. So this is how you self-examine. And then you self-examine your axilla, the area under your arm or armpit, I would say. So self-examination should be done on monthly basis, especially starting from the 20s. Then there is breast examination. If after 20 years of age, it's recommended that you get your breast checked up every 3 years, especially if you are at the risk of breast cancer, if your mother, if your sister, or if you have any other family member who is direct blood relative to you and they have a very strong history. You should get your clinical examination done. If you have genetic predisposition for the cancers, get your clinical examination done. But if every year starting from the year or from the age of 40s, a regular annual mammogram plus clinical examination should be done. So a mammogram is helpful after 40 years of the age, because breasts are not that much dense in those females. But if you move age bracket from under the 40s, then the ultrasound is helpful in the dense breast, because in reproductive ages breasts are very dense. So it is hard to differentiate between the cancerous. growths or cancerous changes in the female breast with the normal breast tissue. So under 40s, ultrasound is very important, I would say, diagnostic tool. But after 40s, mammography is the best way to diagnose at as early as possible. So all the women, irrespective of their family history, their any sort of history of the breast cancer, they should go for annual screening or for annual mammography programs or clinical examinations. So, men and breast cancer, what can we do for our females? So, basically, men have a very supportive role throughout the diagnosis, throughout the treatment, and the after treatment time. So, basically, if any of the female develops a breast cancer, that is very unfortunate, first of all. Then they go through a very, I would say, painful era of their life, the most painful, due to the chemotherapeutic drugs going on, due to the radiotherapy, due to the surgeries that can cosmetically affect them a lot. So this is how you can play your part. You can be emotional support of your partner. You can be in term of cancer treatments, they can also be very expensive. So monetarily support towards your partner can also be very helpful and be can alleviate their stress. So breast cancer, as I said, 1% of the men also develop cancers, but it is very rare that men can get breast cancer. In let me tell you about the male presentation of the breast cancer is in which you usually have they tend to grow a lump in their chest just below the nipple. So those usually if a person have gynecomastia that are kind of circular growths around the nipple, they are benign. But if a person grows a band like growth below the nipple or in any direction, so that can be a red flag. So those person can be uh, get clinical help, get clinical examination done, get ultrasound done, or biopsy of that specific mass can be done to evaluate whether that is cancer, whether that is a uh, benign mass, or whether that is operable or not. So usually symptoms of the male and female breast cancer are the same. As I said, that lump cannot be usually not be painful or not usually tender, and might have skin changes over the breast tissue, might have changes on the nipple. So, but the usual common presentation of the male breast cancer is development of band-like growth under the nipple. So, band-like growth is a red flag. But if you have like if some person is a bit overweight, and if they have like gynecomastia is basically a development of fat pad at the nipples that mimic breast like structure. So some of them might grow a gland as well, but that those are non-functional. So those gynecomastia like or ring like growth is normal. So usually it can be felt as a disc below the nipple. So this is a presentation of gynecomastia in man, which is non-cancerous, but there is a presentation that is band-like, which can be cancerous in men. So takeaway messages: most changes are harmless if they are in the reproductive age, but they still need you to check them. Any kind of lump should not be ignored. So it's not up to you that you should decide whether it is a cancer or not, but it it is on it is your responsibility to self-examine, and if to note even minor changes and report to your doctor and seek help. So I would say professional help. They can help you diagnose with the type of lump or type of growth, whether it is cancerous or non-cancerous. Even if it is non-cancerous, you should seek medical help for that too. So regular checkup and early detections can save lives. As I said, before 40, ultrasound and clinical examination and self-examination, and after 40s, annual mammography, self-examination, and clinical examination. That's all. If you have questions, please feel free to ask.